Hey folks, Doug Blake with Body Design University. In this video, I want to give you some tips, a few tips on how to do the dumbbell row, single arm dumbbell row. Now, just keep in mind, you can do most of the tips that I'm going to give you with a barbell as well, but single arm dumbbell rows appear to be a little bit easier for the average client to deal with for a couple of reasons. Also, keep in mind, there's two ways, or in one sense, I guess you can say three ways that you can utilize this information. And probably some of you are looking going, well, how can he explain things to me when all it is him sitting here at a desk? And that's why I want to show you a couple of ways, give you some tips, show you a couple of ways that you can help explain things to your clients. And that's why I'm going to do it in this manner, by not actually showing you how dumbbells. I'm just showing you a couple of movements that I think will be very, very helpful. Because remember, three ways you can do online. A lot of you are doing online or will be doing online training. How are you going to explain it? If you're talking to a client, just like I'm recording this video, if you're on video with them, you'd probably want to be telling them, okay, go like this, do this, do this. And you've got to explain it to them. Being skillful at explaining and cueing things to folks is actually a very valuable tool, not just showing. Of course, showing can be very helpful, but if you're doing online training, for instance, and you're doing a high level or high service level coaching type of scenario where you're talking to somebody and trying to kind of coach them through exercises, if you're doing that, you got to be able to talk them through it. If you are doing small group training, 3, 4, 5 people, or even more than that, it's very difficult in a short period of time that you have to train people to sit there and go and work with every single individual. It's better to have the skill of doing what I'm going to actually do with you, which is explain some cueing and show some basic movements that you can do in a couple of seconds with this particular exercise. Of course, that leads us then to one-on-one training, which quite honestly, in one sense, is the easiest way to train people. The other two scenarios, small group and online, don't think they're easy. Don't think that they are easier than one-on-one. No, one-on-one is I hate to use the word easy, but it is easier. It's easier to do one-on-one because I can literally, without having to worry about other people, go, okay, Joe. All right, Jane. Okay, Mary, Bob, go like this. Do this. Here, see, I can work with that individual. So in a sense, my cueing skills, my demonstration skills are not as important because I can physically manipulate somebody. And when you're doing a one-arm dumbbell row, again, you can use it for other back exercises, not just single-arm dumbbell rows, but it's sort of a preference to do that particular exercise. The one-on-one scenario allows you to do those things. So with that in mind, by the way, before I even get into this, make sure you subscribe to our channel. Right? You hear this all the time when you're going through YouTube. Subscribe to the channel, hit the like button, right? Because that helps the channel a lot when you do those things. Of course, there's a little comment box or a little comment thing underneath there. If you write understand, or this was helpful, or Doug, I had no idea what you're talking about, can you explain it better next time? That's actually helpful as well. But let's go ahead and get into it. One arm or single arm dumbbell rows, often called lawnmowers, right? Because it simulates pulling the, do they even have those anymore? I mean, aren't all lawnmowers like push button deals? I don't know, but it used to be called the lawnmower because of the string that you pull to get the motor going. Irrespective, single arm dumbbell rows is what I will normally call them. Why are they the preferred sort of exercise or preferred method over other really good exercises? Well, here's tip number one, is it allows the average client to take stress off their lower back by simply because they're using one arm, they can brace the other arm on either the dumbbell rack, wherever that is, or they can go over to a bench. Now, remember, there's three standard ways. I don't really use the third way that I'll just mention briefly. But the first way, especially if you have a dumbbell rack, is just to use a dumbbell rack. And I simply have my clients grab the dumbbell, put one hand on the rack, and brace their body. And this way they can do the rowing movement. Now I can say that, okay, grab your dumbbell, lift with your left arm, lift up your rib cage, arch your back, keep your head neutral, looking straight ahead, brace your hand, keep your knees bent. The arm that is working is the same leg that is behind you, and you do an offset stance. Now I can explain that with my eyes closed. I can just explain it to somebody and they should be able to move into that position. Okay. So again, think about the scenario that you're going to be in. One-on-one, small group, or online, talking to somebody on a video camera, like a Zoom meeting, for instance. Can you speak them through it? That would be a great skill to develop. So tip number one is brace the arm on the dumbbell rack, or you can bring them over to a bench, right? So they would put they prop their knee and their hand on the bench. Both ways have benefits, and both ways can be, or I wouldn't say negatives, but I would say that the best way to do it is on a bench, simply because it allows the torso to lean more parallel to the ground versus a dumbbell rack where the hand is going to be up a little bit higher. Therefore, the torso is up at a higher angle. The benefit of doing it on the dumbbell rack versus the bench is the very fact that the dumbbell rack is right there. With the bench, I've got to grab the dumbbell, bring it over to the bench. I know some of you are saying, really? Is that a big deal? If you're using 60-pound dumbbells, maybe it is. I don't know. But the point is that if you were going to see it from a positive and negative perspective, I would say that the only drawback to doing it on a bench is you got to take it off the rack and bring it over to the bench. Now, remember, we're talking about different scenarios. In a one-on-one scenario, it's no big deal, right? That's no big deal. I can literally take the dumbbell, bring it over. I've got time to do it. In a small group, now you're asking 3, 4, 5 people to take their dumbbells off the rack and get everybody over to the bench. That's the only area of logistics that you may want to reconsider, at least keeping it on the dumbbell rack. So you see the difference? Great exercise, irrespective, no matter how you do it. So that's tip number one. Always use single arm dumbbell row so you can put the hand and brace it on something to take the stress off the lower back. That leads me to that third option that I generally don't use with the average client. Now, I will use it with somebody that obviously has the lower back integrity, stabilization integrity, to where now they can literally take the dumbbell and prop their hand on their knee or their elbow on their non-working arm side knee. Remember, still the same offset, and then basically they're able to put their arm on their knee and do their rowing like that. So now, instead of using their hand to brace on the dumbbell rack or going onto a bench with the knee and hand on the bench doing the row, they're basically just taking the weight off the rack and literally kneeling down so that that opposing elbow goes on that forward knee. And now they can do the exercise that way. Boom, drop the dumbbell, move right into the other arm and do it that way. Okay, so that's that third way. I just kind of say, hold off on that unless you've got, more fit individuals, especially when the weight gets really, really heavy. The benefit to that, of course, is that there's no impediment. There's no bench I got to worry about. I can get my torso as low as I want it, right parallel to the ground, versus obviously the hand on the dumbbell rack. So now I'm going down lower, like on a bench, right? So I can get my torso down. And remember, when training your back using dumbbells, barbells, in any case, getting your torso more parallel to the ground is what's going to allow for more effective tension develop on the lats due to the biomechanics, kinesiology of what the lats do, and the position, obviously the position of the load and the line of force. And that's just something to keep in mind. So that's tip number one. Tip number two is going to be the actual range of motion. And this is critical. And this is why I put this sort of high on the list. First is that positioning stuff. Second is the range of motion. Quite often I'll see folks that will go all the way down and lock their elbow way at the bottom. That's not necessarily a problem, but I don't like to teach potentially dangerous movements. So even though a client is not going to hurt themselves necessarily with a 25, 30-pound dumbbell going all the way down, smooth and controlled and locking the elbow. I would prefer to start the teaching off correctly, meaning do not allow the elbow to lock. Now, that's the way I would say it. You notice I got my hands off. I can literally point. Do not lock your elbow at the bottom. Go down smooth, controlled, and slow. Keep a slight bend to the elbow and pause. See? Now I've cued. That's a cue. Pause. Don't lock the elbow. Go down smooth. Stop. Hold it for 2 seconds. That's one of the ways you can cue people into getting into this understanding that the movement needs to slow down enough through the negative, right to that very end position where they don't lock out their elbow. They keep it bent slightly. And if they do that, they will keep tension on their bicep, which is critical to the stability and integrity of the elbow, because as soon as you lock out, you are now losing, generally, you are going to lose tension in the bicep. And now the stress is on the joint being essentially pulled, I'll say it, pulled apart, so to speak. But as long as there is tension, there is torque on the elbow. Torque on the elbow means that there is compression at the ulnar radial ulnar component on the humerus. So just think about that. The radius and the ulnar, it's really the ulnar radius is kind of off to the side, and the humerus, right? The upper arm bone. So when you lock out, now because the dumbbell, the weight that you're holding, that weight is still, line of force is still straight down. It is now essentially pulling the joint, and now you've got soft connective tissue that's effectively holding the joint in place, versus keeping the elbow bent ensures that there is torque generated, right? Torque, angular force, by the flexors at the elbow, the biceps, the brachialis, brachioradialis. So as long as there's some slight bend in the elbow, remember, compressional force is what we see when the muscle tightens. So when muscles around the joint tighten, there is compressional force at the joint. We want compressional force holding the joint in place. That's the stabilization. That's why I don't lock out at the bottom. And by goodness, for sure, don't drop it. I mean, talk about a disaster, potential disaster on the elbow. So that's tip number 2. Do not lock the elbow at the bottom. It's smooth, it's slow, and controlled. You'll notice I'm explaining this to you without, and by the way, I have to use my hands to do it. But that's how I would explain it to somebody, like in a small group. If I've got a couple of folks, I could have everybody, okay, everybody, do not lock your elbows. Make sure you keep your elbows bent, tensed at the bicep at the bottom position. And I can look 3, 4, 5 people, one-on-one. Easy. Don't do this. Don't do that. I can literally go and help the individual. Talking to somebody, again, I'm using these 3 sort of variations or scenarios for you. But if you're doing right one-on-one, it's like this, small group training. And if for some reason, again, you're doing a coaching video or a coaching one-on-one conversation live, you'd have to be able to explain it to somebody anyway. So that's that second tip on the range of motion. The third tip that's really, really important, a lot of folks get this wrong, is the position of the head while you're doing this. Okay. So there's 2 general ways in which people screw it up. One is they look down too much this way, neck flexion, cervical flexion this way while they're doing the exercise like this. And so they're moving their head, which is going to tend to collapse the lower back shoulder girdle. You're going to get, generally, remember, when the chin tucks forward, there's an almost autonomic response to do 3 things: internal humeral rotation, shoulder girdle protraction, and loss of the lordotic curve in the lower back. Listen to that again. You can do it yourself, just watching this video. Tuck the chin down, and automatically your shoulder girdle rounds forward. The shoulder girdle rounds forward. Let me do it in the sequence I said. Chin tucks down, humeral internal rotation of the humerus combined with shoulder girdle protraction, which is when the shoulder girdle or the scapulae abducts and moves outward, allowing the shoulder girdle to move forward. That's known as protraction, shoulder girdle protraction. And then, of course, simultaneously, this increased kyphotic curve in the thoracic spine then causes the lordotic curve of the lumbar spine to lessen. You round out your back. How's that? Is that better? Rounds out your back. So internal humeral rotation, shoulder protraction, shoulder girdle protraction, and then posterior tilting of the pelvis, or which is combined with decreased lordotic curve. You can't arch your back as much. And so you're constantly telling people that do this to lift their head up and look straight ahead, neutral. When they do that, the cue is lift up your rib cage. You could do that now. As you're watching this video, lift up your rib cage. And when you do that, what happens? The exact opposite of the fetal position you moved into. External rotation of the humerus, shoulder girdle retraction, meaning the shoulder blades get pulled together. Lifting up the rib cage also increases the lordotic curve. You get the point of this? So that's tip number 3. Head movement down here. The other part of tip number 3 are those people that do just the opposite. They look way up like this while they're doing the movement. Okay, what's the problem with that? Well, in general, lifting up too high, or this extensive extension of the cervical spine, cervix up here in the neck, this overextension or hyperextension this way is not so much a problem with retraction, because it actually helps with retraction. Like try pulling your head all the way back behind you. And what happens? You don't go like this, do you? You don't pull forward. Can you hear me with my head away from the mic? You don't pull forward and internally rotate. No, as soon as you lift your chin up, in general, what's going to end up happening is you're going to have the exact opposite of that movement this way. You're going to tend to externally rotate. So that's okay for that. That's not where the problem is. The problem is with your neck. So if you overextend or you hyperextend the cervical spine, you're going to get pain through your trapezius, because there's going to be an excessive contraction of the upper trapezius muscles. Of course, you can always pull the smaller muscles that maintain stabilization in the cervical spine as well. And so those two head positions are combined into tip number 3. So keep those 3. And those are really the 3 most important. Are there other issues? Sure, hand position, but they're not as potentially dangerous as the 3 that I just gave you, or potentially problematic even with respect to developing tension. Okay, so let's review it. Tip number 1, hand position, right? Either on the dumbbell rack or on a bench, or again, if you had to, elbow on the knee, right? So that's allowing for one of the biggest issues that we find when we train people, which is that they feel their lower back and they're like, my lower back hurts or whatever. But that's one of the benefits of doing the single arm dumbbell row. So that was tip number 1. Tip number 2 is the range of motion. Don't lock that elbow out. That's just dangerous. You can hurt somebody. And over time, you can create ultimately you can create an acute injury through chronic inflammation that's occurring because you're extending all the way. And again, every time you extend and lock the elbow out, you are potentially relaxing the bicep flexors of the elbow and allowing for now the full effect of that pulling apart of the joint to be now held by the ligaments and other connective tissue. And you don't want that. That's tip number 2. Tip number 3 is the head position, right? Look, foot position, sure, that's important, but it's not as critical. But the head position, yeah, you'll have people even going, geez, my neck is killing me. Right. But, well, heck, you had your head way back like this while you were doing the exercise. No wonder it hurts. Or you like this and you allowing collapsing of the chin. And by the way, collapsing forward this way is going to be really hard to get the proper movement. Are there other elements to this? Yes, but those are the 3 main tips for doing that exercise properly. So as always, every week we come out with new materials and we tell you the same thing. If you understand it, write understand in there. If you got other comments on this video or even other videos, you can let us know. But if you're interested in becoming a certified and qualified trainer, please click on the link in the description box below. We're always interested in hearing if the materials and content we're providing you have been helpful. By the way, every Wednesday night, Quizlet Live, every Wednesday night, 6 to 6:30 p.m. Eastern Standard Time. Quizlet Live, just a great way to study, learn the appropriate materials, concept terms that are going to help you to pass your BDU exam for sure, as well as the other exams that you will be taking. Just keep in mind that when we go through this material, go through this content, it's very helpful if you let us know that it was useful, and you can do that in the comments section. Have a great week, and we will talk to you soon. Take care.